Rebekah, tell me a little bit about, for the people on my end who have never heard of you or may know a little bit about you, tell you what you are, who you are, what you do, why you do, and all that fun stuff.
Sure. I am Rebekah Mustaleski. I am a certified professional midwife in the East Tennessee area. I've been a midwife for about 10 years now. I help families have their babies outside of the hospital system. So we do mostly home births. We do have a birthing suite in our office where some people choose to have their babies instead of being at their house for whatever reason. We've had all sorts of reasons for that. But I come from a place where I believe that pregnancy, birth is just a normal part of life. This is something that our bodies are made to do, and that in general, when you let that body system do what it needs to do and wants to do, that things go well. And pregnancy and birth is a normal, natural process. And um, I am about supporting women to be healthy prenatally and then even during conception and postpartum so that that body system can work optimally and function well, and that we can avoid all the complications of things that can potentially come up during those major life events. So um, I love the beauty in birth. I feel like those are really precious and sacred moments, and I love getting to be part of that with families. And I also love helping people stay at home and do that.
I love it. And she's amazing in what she does. My wife and I were clients of hers and will be again in the near future because she's just really good at what she does. So I'm excited and we've had conversations on and off about things, and this is well overdue, and I'm happy it's happening, and I'm looking forward to this topic to dive in. For those who may not know, I'm Dr. Vic Manzo. I've been a chiropractor for about 15 years. I had a practice in Illinois for 11, and then we moved down, like so many other people have been moving in the Tennessee area. And originally did not plan to go back into practice, but after adjusting a couple families, helping out some chiros, I missed that aspect of being that individual to help and shift. And it's more of like a mind shift, like, wow, I didn't realize chiropractic does this, holy cow. Or wow, you're helping the whole family, and now we can, life is a little, I'm gonna say, easier in a sense, but we can handle things better. And being that person and helping kiddos not go down the what is it now, almost 80% in the next 2 years, by 2026, chronic illnesses in kids. And it's just like, all right, I need to get back into this and do this in some way, shape, or form. But I'm very pediatric focused, very family or wellness focused, and so forth, and very neuro focused. I'll explain what that is and what that means. I don't like saying that. I tell patients this all the time. I'm a neural based chiropractor, but I'm like, I don't like saying that because all chiropractors are, even if they don't know that they are. But at the same token, unfortunately, our profession, I won't get down on a soapbox with this, but on the viewpoint of chiropractic has been very watered down. If I ask you what does chiropractors do, the perception of the public sees it totally different than what it is. Even on day one, when I talk to patients, I always tell them, like, chiropractic doesn't treat anything. Like, we don't treat any illness, condition, symptom, or disease. And then sometimes I get the deer in the headlight look, like, why am I here? What's happening? And I'll say, let me explain what I do. And then once I do, you'll understand why that helps in those areas and so forth, especially like something like fertility.
Mhm.
So that's a little bit about me. Now we're in, we work out of the Roots and Wings, and we also have an office in Morristown. So it's one of the things where we're really trying to shift healthcare in a lot of ways. And Knoxville has a lot of great, I love Knoxville for the area. I didn't realize it as much as coming here. There's a lot of support for pregnancy and natural birth and all that stuff. I just love it. But we're on the topic of infertility in a sense and how to be more fertile. So I love to just pick your brain and just see, like, what are some of the things that, I know, love how you're very science, very research stuff. I mean, I just love that. What are some of the things you've seen, or your opinion and so forth? Because I always like to go to, why are we seeing fertility issues be the way they are? And then what are things that we can do, and what we'll talk about today for all the people watching and listening, of what they can do to become more fertile in many different ways.
Mhm. So I'm going to start just by talking about the menstrual cycle, because although there are two people who play a part in fertility, both the male and the female, um, the female is the one who has to conceive. So the sperm does have to be healthy, and that's certainly a part of it. But the female has to make a healthy egg and then also have a healthy reproductive system. And I feel like there's really two things that go into that to creating that health and wellness for optimal fertility. And that is, well, it has to do with how you take care of yourself. So one is going to be nutrition, the food that you put in your body. And the second is how you take care of yourself emotionally, and managing stress and your nervous system, which I know Dr. Vic is going to talk about in a little bit. But those two things really impact how our body functions. So the nutrition part of it determines whether or not your body has the minerals, the nutrients that it needs to be able to create optimal blood flow to the area, to provide the nutrients for a healthy egg, to nourish that endometrial lining for healthy implantation, to have the hormone levels that you want to have for both a healthy menstrual cycle and then also for conception and a healthy pregnancy. And if you don't have those things, or if you are eating well, but your body doesn't have the minerals so that your cells can absorb those nutrients that you're eating, that's going to impact everything. It's going to impact your menstrual cycle. It's going to impact your ability to conceive. And I am a huge proponent of using your menstrual cycle as a vital sign. I think that our bodies give us that information every month for a reason. And if we are taught what to look for, we can learn a whole lot about ourselves and how we're doing, how our body's doing in terms of getting enough nutrition and our nervous system balance and function. Unfortunately, too many women aren't taught what to look for or how to read their menstrual cycle as a vital sign. So what I mean by a vital sign is it's really no different than your blood pressure, your pulse, your temperature. Um, you know, I would guess most adults know that if they're running a fever, so if their temperature is over 99, probably there's something going on, and they typically try to take care of themselves to get themselves feeling better. And the menstrual cycle has those same sorts of signs to let you know that something's not going right. And it's just that we're not taught what to look for. So I love helping women learn that so that they can take that information and use it to make any adjustments they need to make in their life, whether that is lifestyle things to balance their stress levels, or help keep their nervous system healthy, or their nutrition to be able to make sure that they have everything that their body needs so that it is able to have a healthy menstrual cycle and ovulate and conceive if that's what they're trying to do. So yeah, that's maybe a little long-winded answer for that, but it is all part of fertility.
No, I love it. And correct me if I'm wrong. Isn't it? Because isn't it where with women they have their menses? It's actually whatever they had in the month of is actually 3 months ago of where they were,
Yes.
right?
So the egg that so egg development is actually happening for about 7 or 8 months before you ovulate that egg. Now, the really important, it's all important, but like the last bit of development that really contributes to the health of the egg that is ovulated in that month happens in the 3 months before you ovulate that egg. So yes, to some extent, you're not going to see full benefits of whatever changes that you make for 3 months because it takes that long for that egg to develop. Some things you can see improvements on. So if we're talking about making improvements to help with like inflammatory levels, or if you're making changes to maybe they're not even ovulating at all, you can change that in a little bit quicker. But the ovulation is going to affect like progesterone levels, and that's going to take a little bit longer for you to see results for if you're trying to make changes. But like I said, there are several signs that you can watch for that give you a lot of information. And while you might not see signs for months on some of them, you could see improvements in others a little bit more quickly.
I love that because I just want to make sure because I used to tell. I mean, I read a couple books in the past, and I remember I would always share like when I was in practice and working with fertility women who had infertility and couples and men too. It'd be like, well, for more speaking on women though. I'd always tell them like we got about 120-day window, give or take. That was always my thing. I said it's 90 days, really, technically, somewhat. And I just want to make sure this is where I love it. You're the expert on this in the sense I love to just make sure I'm saying the right thing accurately.
You are.
I'm always making sure. Even patients be like, if I'm like 99%, like I'm 99% that's certain, but don't go with that until I have 100%. They're like, you're 99%. I said, there's still that 1%. I'm not okay with that. It's got to be 100%. But I would always say, like, you got about 120-day window to get things in order, and then once we have that good period, then I'm like, let's go. It's off to the races now. Have
Yeah,
fun, and however you have to get
that's right.
creative. Make it fun. Um,
Yeah, I love that. Setting that expectation is helpful too, because if you think it's going to happen sooner, it's way too easy to get discouraged in that, 3 to 4 months time where you're like, well, this isn't making any difference, but you do have to give it time to like actually see the results from your hard work.
I love that, and I can't wait to I'll ask more questions in depth about like the signs and stuff because I'm curious for myself. I'm always learning from you, so it's always great when we have conversations. I mean, you share at least one nugget where I'm like, so cool. All right, that's something I got to put in my. I don't think I'm ever going to need to explain that, but if it ever comes up, I have something now to share. Um, but yeah, no, because on my world, it's always about we look at the nervous system and specifically the autonomic nervous system, which just means everything runs on its own. Things that you don't even have to worry about. It all runs pretty much on its own, and we can influence it in some ways through your breathing and stuff like that. But at the end of the day, this is the system that has a certain tone, a certain way how it operates. And I kind of teach it real simple. When I was in my pediatric certification, they said gas pedal, brake pedal. That's the two parts of your nervous system. The scientific terms are sympathetic and parasympathetic. But I like gas pedal, brake pedal because most of us drive a car. And you understand when you hit the gas pedal, everything speeds up. It revs. Blood pressure, heart rate, breathing rate, mental impulses, all these things start to accelerate. Brake pedals, the opposite, slow it back down, right? Get it, that kind of thing. But when I kind of look at and what I've seen over the years is we're more in a society of sympathetic dominance, which means for the public is that you are stuck in the gas pedal. Your nervous system's revving without you knowing because your nervous system is going to adapt to how you live life, how you think, how you eat, how you move, the energetics, all this stuff. And so it conditions us in some way, shape, or form. So why is that important when it comes to fertility then, if you're wondering? Because here's the thing, when you're revving in that gas pedal state, this is known as the fight or flight, fawn or freeze. This is that part of that nervous system that is going to be like, okay, way too stressful out there. We need to protect. We're in survival here. Back in the day, that was very healthy. Right? You had a lion or a jaguar, or my daughter loves animals right now, and I'm loving it because I'm learning all about more. I love jaguars, and I know this is a side topic, but I'm digressing here a little bit. I love animals, but anyhow, for my daughter and researching more and learning more with them. But we used to have that in front of us, and then once it was gone, brake pedal comes back. We're good. Healthy response. We see it in animals all the time. You see it in ducks when they get into a fight. Once they're done, they shake their feathers off really quick. Dogs do it when they fight. All of a sudden, they pull away and they just shake like crazy, and that's getting all that excess stress out. In today's society, the lion's always in front of us, but not really. But it's in our mind, and so that's what's being stuck in that gas pedal is. So when it comes to the criticalness, then what I see on my end is that and Rebekah, I know you know these things already. It's like the brake pedal is all about the growth and development, right? It's the self-regulating and self-healing mechanisms, right? And I'm pointing to the big word there is the regulating part. Menses is a regulating cycle. You kind of have your body's regulating. It goes through the different cycles, first 2 weeks, last 2 weeks. And I know you can speak way better on that than I can. But it's one of those things where that regulation is not going to be in sync. Because if you're firing the gas pedal, which is survival, you're talking about blood flow to certain areas. For women, that's right. And the circulation might not be there as well. For men, it may not be there as well either. And I can share tons of stories on both the male side and the female side of my own experiences. And it's one of those things where when we're stuck there, then all of a sudden, this is where it starts to see hormonal imbalances or thyroid issues. And I'm just speaking on women per se. It could be low testosterone in men, not great for mobility in the sperm, not having a high sperm count. It all plays the same stuff because gas pedal is protection, survival. How do I get through this? Brake pedal is slow down, regulate, get back to the natural harmony and tune that the body needs to be in. And when it can do that, it can adapt and handle things, and then it can thrive. It focuses more on thriving rather than surviving. And that's kind of the big element of what I see primarily, and I used to have technology we use in our office to actually show patients, like if I'm working with someone who has infertility, I look and go, you're stuck in gas pedal. It is right there. I'm seeing it on your heart rate variability. And when we see that, then all of a sudden that becomes an issue. It's like, we got to get that back. No, we can force things. We can force things, but we have to get that back in center, because this is going to cause not only issue. Let's say you get pregnant, but then it becomes, all right, we got pregnant, but now what about, remember, we're not in a growth state. We got to grow a baby properly. We got it. And then there's all this other stuff, structural, and I won't get into that because that gets in the pregnancy. But that's the common thing I see. So what are then, I love to tie this all together. I know we're going to do that so well. But what are some of the things that then are signs that women can look for that when it comes to you're talking about the menstrual cycle and so forth, that we haven't, they haven't been taught to look at. So whatnot.
Yeah. So just to tie in with what you're saying, like when you get stuck in that gas pedal state, so think about a car. When you're using the gas pedal all the time, it uses fuel. Similarly, in the body, when you are in that sympathetic state, it burns through certain nutrients and minerals in your body, because that is what your body is doing. So it depletes your body of some of the nutrients and minerals that you are going to need to have a healthy cycle. Your body really wants to be in balance. Like the autonomic nervous system should be able to go between the sympathetic and the parasympathetic as needed. Like you were saying, like you have a moment of stress, it can go deal with that. It can, get the blood flow going to your muscles so that you can respond well and quickly. And when it does that, it pulls that blood flow away from other parts of the body, such as the reproductive system. And there's really good sense behind that, because your body doesn't want to conceive while you're trying to fight for your life against a jaguar, like that's not a good thing. And so it's like, well, hold on, we don't need the reproductive system right now. We need it to go to these other parts of our body. And that's fine. But if you don't have that balance, what you're going to find is you don't have that good blood flow. And speaking of female fertility, what you see is that you don't have good egg development. You don't have good endometrial development. And so the signs you would see in your menstrual cycle would be signs that you are not ovulating, or you have a really irregular cycle, or when you do have bleeds, they're really light. Those really light bleeds indicate that endometrial lining is not developing well. It's not getting to have that thick, nutrient-dense lining that a baby is going to need if you conceive and then it implants into your uterus. You need that. A light cycle sometimes can mean that you didn't ovulate. So your body needs that blood flow to go to your reproductive system so that you can have the nutrients going to both the endometrial lining of your uterus and to those developing eggs, so that you can have a good, healthy cycle. Signs that you would see, in addition to those other ones, would be having a regular cycle. So, and that doesn't mean a 28-day cycle. Like, we are not textbooks, so I'm not saying like every 28 days you bleed. There is regular variation in the menstrual cycle. But you should be having a fairly regular cycle. Somewhere between like 26 to 32-ish days is pretty typical for a lot of women. And really important to that is that you have a healthy luteal phase. So the menstrual cycle is broken up really into 4 stages. One is your period, where you have the blood flow. And then also right along that same time is the follicular phase of your menstrual cycle, where those egg follicles are developing in preparation for ovulation. In the middle, which doesn't always happen in the middle, but between the follicular phase and the luteal phase, you ovulate. That is the crowning glory of your menstrual cycle. It is actually not considered a true menstrual cycle if you don't ovulate. So ovulation is key and essential to having a healthy menstrual cycle. And that happens between the follicular and the luteal phase. And then the luteal phase is a little bit different for everybody. It's generally around 12 to 13 days. Most people have their own individual. So like somebody's normal might be it's 11 days. Somebody else's normal might be that it's 13 days. But it's usually pretty consistent. If it's too short, so say I'm working with somebody and their luteal phase is only 9 days, that is a sign that, well, probably they're not getting enough protein, to be quite honest, if it comes down to one thing. And it's also going to affect the health and nutrient density of that endometrial lining. So that's not quite enough time for that lining of the uterus to really be ready to receive a fertilized egg and be able to nourish it for a healthy pregnancy. It is a sign that your progesterone levels aren't high enough, which can also impact a healthy pregnancy. So having that luteal phase be at least 11 days. I mean, 10 is sometimes okay too, but 11 is really ideal, is beneficial for knowing that you are getting balance in what's going on in your life. You're not stuck in that gas pedal mode all the time, and that your blood flow is, being able to switch back and forth between your body systems like it needs to, and that your reproductive system is getting everything that it needs.
I love that. Now, is there also like looking at, and it kind of makes in my head, it relates, but I want to ask where even like with flow, there should be a certain amount of flow, like there's a healthy flow, or is it just the more flow, the
Yes,
better? Or there is a point where it's like, okay, we don't want too much flow.
you don't want too much flow. It's true. um, your menstrual flow should they've actually done studies where they've measured like what a normal menstrual flow is, and everybody's flow is a little bit different in terms of like how many days they bleed, but a normal menstrual flow amount is about 80 milliliters. If you're losing more than that, then that's signs that there's other things going on. If you're losing less than that, um, sometimes that's okay. And sometimes, like I said before, sometimes that's a sign that maybe you're not actually ovulating. Maybe your luteal phase is really short and that endometrial lining isn't developing as well as you would want it to. But yeah, there is a normal menstrual flow too.
I just had to ask. I mean,
Yes.
I used to always say like when I tell women we were working towards these, I'm like, I need to, get the, what is it? There's the Lena Cup, the Diva Cup. There's so many names to
Yes.
them now.
There's so many cups.
I remember back then it was only one, and then I was like in 17, and all of a sudden by 20, I'm like, what? They're telling me a different, like, doc, you don't know that one? I'm like, I don't know. What is that? And then they
There's all
told me.
kinds.
Now there's
There's
so
cups
many.
and there's discs and there's all sorts of stuff.
See,
Got all kinds of options.
yeah, I gotta I gotta
Yeah.
get caught up to all that. But I'd always tell them that, like, what's the flow? Where are you at? Measure it, monitor it, because that gives us a lot of indicators and knowing where you're at with things. Because it's, as you just shared
Yeah.
just so nicely about.
I'll tell you another flow tip is that you shouldn't have a lot of spotting around your period. Like your flow should start and then your flow should stop. And when you have spotting on either side of that flow, that can be signs of your hormones not being balanced quite well. Because generally it should just start and then it should go away.
I love that. It's a great tip there. I mean, it's good. Another nugget there. Like I told you guys, she always shares nuggets. I'm like, okay, cool. That's good to know. Because in my head, I'm always looking at things from the neuro side and just saying, okay, when we calibrate things and do things in a certain way, and it's like, okay, how do we know we're doing that? And I always love the functional side to show and prove. It's like when I work with kids and I'm like, yeah, chiropractic in the state of Tennessee, I gotta be careful how I say this, but there are peer-reviewed studies that state that a chiropractic can help with the immune system and help it be more adaptive and responsive and all that. But it's always great to when, and I say that, I say the word great. Somebody's like, I can't believe you're saying it like that. But when someone I'm working with gets sick, a kid gets sick, but I see the robustness of them responding so well and handling it. Let's say usually this happens, so I'll see it often where kids in my office, the only one getting adjusted. Family gets a whole bug. The one who's getting adjusted, maybe a day, responded so beautifully, a little fever, went away and gone. And everyone's struggling for 3 to 5 to 7 days. And I'm like, yep, I wonder what that has happened. So the functional side of things.
Mm-hmm.
And that's why I love when I was, before in my old practice, it was the same thing, like, flow, where's it at? And I used to say, it's a functional tool that we can use. You don't have to spend any money. You're going to have the natural flow anyhow. So just go get this if you don't have it, and then just monitor it and make sure we're right around a certain range. So that way we know that's an indicator for us of where we are, where you are with things and so forth, on top of the chiropractic. Because I always tell people, like, chiropractic, in my world, how I see things from health is like chiropractic is that foundation. Without your nervous system controls everything. Without that, you can't function. There's no such thing as lie. I mean, look at somebody who has been like Christopher Reeve, what happened to his neck and so forth, right? Nervous system is very critically important. But it's not the end all be all. And you were sharing some other things like with nutrition and so forth, and protein consumption. And I know you're big onto that, and I love that. And whatnot. because then it becomes lost my train of thought with that with protein, but it's that aspect of it's not coming to me. Anywho, my question was going to come to you is saying, nutritionally though, what are some things then people can look at and do? Because, again, chiropractic isn't the end all be all, but it is in my world that foundation to all things, especially that autonomic. And then what are pieces that they can add nutritionally, if you don't mind sharing?
Sure. I think the most important part of all of our nutritional intake is balanced blood sugar, because that's really important. And I have found that the best way to do that is to make sure that you're eating enough protein. Most of us, especially in the United States, eat plenty of carbohydrates. That's not difficult for us to get or find. And they're really easy. And it's much more difficult, especially when you are being intentional about the foods that you're eating, to make sure that you're eating enough protein. And proteins are important for the menstrual cycle and for pregnancy and fertility, because proteins are the building blocks of life. So proteins go into us creating hormones. They go into the health of the pregnancy, creating that endometrial lining. All of that is going to be done with proteins. And then once you get pregnant and you are actually creating a new body inside of you, those proteins are especially essential. So I mentioned earlier, if you have a short luteal phase, it's often that you're not getting enough protein. And that tends to be really true. There are some other things that factor into it, but I do find that nutritionally, if I have people focus on protein, and by that I just mean, my recommendation is that every time you eat, whether that is a meal or a snack, that you eat something that is a good source of protein. And that helps to balance our blood sugar. It helps to nourish our bodies, and helps our bodies be able to make and do all of the things that it needs to do, particularly in relationship to having a healthy reproductive system.
I love that. And I love how you bring up the protein side, is because it's the one macro that we do not consume enough. It's always overlooked, and it's always the one that's, like you said, it's a building block to all things. Is there a certain, my mind goes right into all right, now protein is a certain ratio or percentage, or, if I'm working with someone who wants to get to a certain body type, I'm like, okay, you got to do it based upon what's the weight you want to be, multiply it by 0.9, and that's that's the protein minimum daily you need to consume. Is there a certain ratio, kind of, formula that you utilize that's for you? I was gonna say algorithm. You can
Yeah.
tell where my mind goes. I didn't know.
So I tell, if you're wanting to have a healthy cycle, a healthy system, you're wanting to have a healthy pregnancy, my recommendation is that you consume at least 80 grams of protein a day. If you are active, you exercise on a regular basis, that is probably going to need to be 100 and potentially even 120 grams of protein a day. Your body just needs that much. And what you'll find is that that is a lot of protein, and you probably aren't able to eat as much of the other macros and food groups that you may have been eating before. And there's a reason for that. And the reason for that is that your body needs those proteins. And when you get those proteins, you don't need to eat those other things, because you have provided your body with what it needed to be healthy and do the things that it is wanting and needing to do.
I love that. And I'm just smiling over here because I could totally relate. I mean, I have to consume, what, 0.9 grams to what my ideal body weight, or what my body weight is roughly. And it comes up well where I want to get to. And it's 200 grams a day. I rarely ever hit. I was telling a friend of mine one time, when I first started doing this a year ago, I'm like, I can't, all I eat is meat. I eat a lot of meat. So I'm like, I can't eat. If I eat all meat, I'm good. I'll clear it every time. But if I add a little something here, or I need to get a little bit of veggies in and my fat, I'm like, I'm full, and I only eat in a small window. So I'm like, I don't know how this is effective. So I get that whole, it feels hard in some ways, but a pound of ground beef is 84 grams of protein. So there you go, right there. There's your 80.
There you
Just
go.
make two
Check.
meals. Yeah, there you go. Just make tacos out of it if you like, or whatever. And but are there certain type? Do you just get into the basics of just protein, right? You don't get into well, it should be. Are you more preference to more certain types of meat, or it's just protein? That's it, and that's the end of it.
So I try not to tell people how to eat too much. Most of us have really emotional connections to food and for the reasons that we choose the foods that we eat. Um, I do prefer animal-based proteins. I think they have a lot of other minerals and nutrients in them that our bodies need. And particularly when you're looking at like reproductive system health, I think those are really important. But you can eat plant-based proteins. You do have to be more intentional because you have to pair them so that you can make sure you're getting complete protein so that your body is getting all of the things that it needs. And I think it is even more difficult to get enough protein when you're eating plant-based proteins. Also, I try to remind people that another thing that is important about protein as it comes to reproductive health is how our body absorbs and is able to use iron. And that plays into me not having the preference for the plant-based proteins because the iron that is in the plant-based proteins is less able to be utilized by our body. I think the last time I read something, it said it was only about 10% of that is bioavailable inside of our system. So when you think that the menstrual cycle, yes, we are bleeding every month, that affects our iron stores. And if you are focusing on plant-based proteins and you're not able to absorb as much of those, and then you're also bleeding every month, that can really affect your iron levels, which affects a whole lot of other things. So anyway, yes, I do prefer I do prefer animal-based proteins. Obviously, considering your source, organic, grass-fed, all of that is preferred, but I know money is a thing, time is a thing, and really when it comes down to it, again, I go with make sure that every time you're eating something that is a good source of protein.
I couldn't agree with you more. I mean, if you get the grass fed and all that, I'm a very biased, well, not biased, it's just research based on all this, but it's like I let the science kind of tell me where, it's kind of going. But even just like the good fats, right? Coming back to the nervous system and what developmentally and looking at all that, the better quality fat you have, the better development of the nervous system, development of the brain, develop just X, Y, Z, everything. And for the human being too, for the mom too, but also for baby, those saturated fats. I mean, I'm not going to go down that rabbit hole because everyone looks at saturated fats are bad. No, read the study. It's not what you think it is. They're actually reversing it now. They're actually realizing, wow, we need saturated fats. They're actually healthy for us. And so I tell moms all the time, like, enjoy a steak, enjoy this, enjoy that. And that's why they say when you give blood, I remember when I was in high school, I used to give blood every semester, so twice a year. And I always remember they'd be like, make sure when you're done giving blood, have meat. You just have a good steak, just have meat. You'll be fine. And I was like, okay. So every time I tell my mom, like, listen, I'm going to go get blood on this day. Can I get a nice big steak so I can enjoy and pig out on? And so it was one of those things where that makes perfect sense what you were sharing about the iron stuff and whatnot. And I won't make this a nutrition talk, so I'll leave it there. I'll leave that out to you on their end. But yeah, it's one of the things where, again, coming back to that protein, plant-based is great. It does have its, things like if you're going to have beans, you can mix it with rice and you get a complete amino acid profile there and stuff like that. But it's just so much easier to eat meat. It's just, especially organ meat. If you can go that route, I'm only saying that because
Yes.
I'm trying out heart for the first time today in an Instant Pot. So we'll see how that goes. But so that's where my mind was at. But yeah, so we talked about, go ahead.
Those organ meats are especially good for reproductive system health. So if you are a meat eater and you are not opposed to organs, liver especially is really great at helping nourish the reproductive system. And I think that is a wonderful thing to incorporate into your regular nutrient profile. I have a lot of clients who aren't comfortable eating it, and you can get from reputable sources desiccated liver pills now if eating it is not something that you're comfortable doing. But so much good stuff in animal organs.
So much. Liver is like they call it now a superfood, just to paste on it. And it's I'm Italian, so I grew up with onions and liver, and that's what as they put the milk, the way they did it, the old, so however they do it. But I appreciate the pills. I've been taking them for a long time because I can't do liver. No, just no. Or kidney or a spleen or pancreas. I just no. Heart, I heard, is not bad if you cook it a certain way. So I'm testing that out today. But
well, you're giving it a try today. That's good. You get an A+ for being willing to try something new.
Long story short, we grilled it one time we had heart like about 6 years ago, and we grilled it, and I grilled it so wrong, and it was so rubbery, and I was like, people say heart's like normal beef. I'm like, I don't know about this. So I heard if you Instapot it, it's a lot safer. So we'll see. No, I love it, and I'm trying to think if there's anything else. Anything else with for the listeners to grasp on any other tips that we may not have shared that you're like, oh yeah, this one's a big one. I want to make sure I discuss. We talked about the menstrual cycle. We talked about the things to look out for. I kind of tied a little bit of that with the nervous system in there. Anything else before we kind of wind it down here a little bit?
I think the only thing that I really want to say is that if your goal is to have a healthy pregnancy and your goal is to conceive, to remember that it's not just one thing that you're looking at. Your body is a system as a whole. And so you really do want to create, and you're building your new baby in your body. So you want that whole system to be working well, because that's how you're really going to build a healthy baby inside of you. The things that are happening in you while you're pregnant affect your baby. There's so much really, really cool research coming out right now that talks about how this baby is shaped and formed and how it affects their lifelong health, which is cool. And it means that you as a mom have this really unique opportunity to create health and wellness for your child while you're pregnant. So like, even if you get your menstrual cycle in a place that it's healthy, remember that your nervous system matters too, and your nutrition matters too. Like, all of this plays a part in it. And yeah, just remember it's a big picture. You're not just looking at one thing. It's your overall body wellness that you want to take into account.
I love it. And when you're talking like that, I always think of like the holistic way of doing things. Like there's never one way with anything. That's why that's why I love being a chiropractor, because whatever I do affects the whole system as a whole. And it's when one adjustment, that's why an adjustment doesn't affect back pain or neck pain or help with fertility. I mean, it helps with fertility, but it doesn't like, oh, this adjustment's going to definitely make you more fertile. It just doesn't exist. But when we make adjustments and remove this interference in the nervous system, it's like a communication system. And the way I kind of share it is like, imagine in a relationship, you have a miscommunication. How does that go? Right? No miscommunication ever goes well in a relationship. It's tension, there's stress. Again, think about that nervous system, that gas pedal revving, right? You're not breathing nice and calm and in this Zen state. Even as much as I practice mindfulness, I don't get that way when I'm having miscommunications. The older I get, though, the more I'm like, hold on, let me try to find where this miscommunication is. But long story short, we go through that, and then our systems are affected by that. So when we're looking at, through the chiropractic, the adjustment as a whole, we improve that communication throughout that body, and that's then the self-regulating, self-healing happens. So when we're looking at fertility, like, I love the big picture you bring, because that's kind of like, I always got the question from parents when they were looking to, if they had a baby already, well, when should I start? This is the famous question I would get a lot, is when should I start chiropractic? When I'm about to, with pregnancy and stuff like that. I said, my comment has always been when it becomes a thought. When you're just in the, like, it could be a year and a half later. You just had a baby. Let's say you're like, we're going to do a year and a half till that happens. Okay, start now. Whenever it becomes a thought, because I explain it in the sense of like, you're having a guest that's going to be with you for about 10 months. When you have a guest over in your house, you want to make sure everything's all perfect and nice and clean and organized and all this stuff. Well, we got to do that to the house. And so there's layering effects to it, like nervous system, nutrition, looking at the menstrual cycle, all this different stuff. I would say get it as best as you possibly can. You can definitely explain this 1,000 times better than me, because you have all the experience with this. Like, you can still prepare everything and still have things come up, right? But what I always say is, like, we're minimizing that probability, and that we're just shrinking it down. We can't guarantee it, but we can shrink it down really, really well, to where you give your body that opportunity. So if something does come up or something may happen, your body will have the reserves from a neurological level to be able to adapt, to course correct, to overcome that in some way, shape, or form, without the things that can happen. And like I said, you can elaborate much deeper. I don't want to share more on that, but it's when you do that part, nervous system wise and everything else, that's when you prep everything to give you that best chance to adapt, the best chance to give the highest level of growth. Because research now is showing, because I look at a lot of things from like imprints and brain and how it gets conditioned. When does personality happen? We used to think it was in this certain period of time after. Now we know it's in the womb. We know the immune system. We thought, oh, when they come out, they're building their immune system. No, they're not. Immune system is actually in the womb, especially the last 3 months. A lot of things are happening, we know now, in the womb, even up to conception, which I always love science because I'm like, how do they know the moment of conception that, XYZ is potential? That fascinates me. But long story short, it's making sure every step of the way that you possibly can to give your best chance to have not only just a very, become more fertile, not just, we've been talking a lot about for females, but it's also for males too. And I didn't talk a lot about that, but, again, we're talking about blood circulation. When men are stressed, we're seeing a high level, more common now, 30 and 40-year-old men with low testosterone, that plays a role on things, sperm count, mobility, the vitality of the sperm. And I can share stories. I remember I was working with a mom for like 9-10 months, wasn't getting pregnant. And I looked at her one day and I said, listen, normally I take on couples. I was like, but I was working with you, but I'm like, I need your husband in here. I just one day flat out said, because she was getting stressed out, as you hear the stories, very disheartening. I've been trying for 10, 11 months. It's not working. I don't understand. I said, normally I do both. I made an exception. And of course the exception comes back and kicks me and it comes back and gets me. So I'm like, okay, husband comes in 5 weeks later, pregnant. And they're like, no way the chiropractic do that. I said, stress. I go, men are different. Our sperm changes like that, especially if you're releasing the first time. Brand new boys are going to be created and they're stronger based on where they are. And there's this whole thing. So they were like, it makes sense, but we just can't believe it. I said, that's fine. You don't have to. I'm not in the persuasion game. I'm not here to persuade you. I'll just tell you what it is and you can take it however you like. But coming back to what we're sharing, because one of those data is, like we were talking about this beforehand, 33% is the couples themselves. That's why before it was 20, now it's 33. And that's the purpose of looking at both. But at the end of the day, it's prep the home to the most optimal, and the chances of anything happening are just less. And it allows you to make up, even recovery after pregnancy and all that stuff. I mean, I'm speaking only from chiropractic. I don't see a lot of postpartum. And there's things you can do to know ahead of time with certain stuff that we do to know. And again, it's not a guarantee, but the percentage, it's all a percentage game for me. I'm always like, okay, 75% chance if I know this information, if they're not doing well, then the chances of postpartum is 75% chance of that. So I'm like, all right, let's play that number to get that down. But it just helps overall. So I can encourage whoever's listening, who've been watching this and listening, definitely chiropractic, nutrition, and everything that Rebekah's sharing here. Anything else to add before we kind of wrap things up here?
No, I just want to reiterate what you said of planning ahead, because I'll take it from the midwife perspective, and that is that pregnancy is a nutrient depleting state. Like, you're taking nutrients to build a new body. So the more you can do ahead of time to like stock your pantry, to speak in like a mom sort of phrase, the better off you're going to be, because you're going to have those resources and reserves for your baby, to keep both of you healthy. Now, your body is really smart, and your body priority during pregnancy is building a healthy baby. So your body kind of prioritizes whatever your baby needs. And I'm just going to say, there's a reason why the wives' tale phrase is that you lose a tooth for every baby you have. And that is because your body will literally pull the nutrients from your teeth and from your bones to build a healthy baby. So if you can prep your body, stock that pantry, make sure that you have that, you're going to be able to build a more healthy baby, and you're going to be able to be a better mom on the other side of it too, because you didn't deplete yourself to a point where your body is now running on empty, to use that gas pedal phrase. Like, you still have reserves in the tank. You can take care of yourself. You're going to be able to make adequate breast milk. You're going to be able to care for your baby. And it does affect you on the other side. And you're just setting yourself up for lifelong health too. So if you want to, be the best person, be the best parent, be the best mother that you can be for this child once they're here, it does help if you plan for it and prepare for it ahead of time. So
I love that analogy, because it just comes back again when how I'm looking at it from like the nervous system. It's just like, yeah, gas pedal revving, you're going to burn through nutrients. And then all of a sudden we're trying to have a baby, and how do we have enough to do that? And the body's smart. It will not, like, it'll do everything it can to figure things out. But at the same token, it also knows that when it can't, and that's where, other things show up, and even afterwards. So I love that. Rebekah, how can people get a hold of you, find you, all the fun stuff
Yes,
and whatnot?
you can find me on Instagram. I'm at roots underscore wings underscore midwifery. And then I'm also on Facebook at Roots and Wings Midwifery. And then also online, you can go to my website, www.rootsandwingsmidwifery.com. If you're interested in learning more about your menstrual cycle or knowing how your menstrual cycle is kind of compared to what it should be, you can go to the shop tab on my website. There's a free download called What's a Healthy Menstrual Cycle? And you can just read through it and see if yours checks those boxes. And if it doesn't, you can always reach out. Happy to help.
I love it. And then, my name is Dr. Vic Manzo, the Wellness Path. Like I said, we have an office in Knoxville and in Morristown. We work out of Roots and Wings in the Bearden area, but we're Wellness Path Chiro everywhere on Instagram, Facebook, YouTube, and our website, wellnesspathchiro.com, if you want to learn more about how we do things a little differently from a neuro approach. We have about what to expect for pregnancy, for fertility, for adults, and for children. So you can kind of see what's the lens that we look at things, so we can see what's going on in that nervous system and so much more. And if you commented on any of this stuff, asked questions, we will get back to those, or I will, at least for sure. I'll tag Rebekah if I see any, directed more for her. But if you have any questions or anything, if you've been watching the replay on this, definitely go ahead and ask any questions. We'll get back to you. Rebekah, it's always a joy to be
Yes.
around you. I love picking your brain. You always have a unique way of sharing things. At least for me, I'm always like, I love that. Like the whole tooth thing, the body will, when you're saying like the body, it's going to take nutrients. I'm like, it's a definition of a parasite. I know I say that very lightly, but but if you define a parasite, that's what a baby is when it's in you. I mean, it's just, it takes nutrients, it's pulling from you, it's robbing your food, your minerals, all that stuff. But at the same token, I love that, just everything you shared here. And I know whoever's listening to this, I got value out of it. And I know many more are going to have multitudes of that. So thank you for being here. Thanks for taking time to have this conversation. And I look
Thanks for
forward to the
having
next one.
me. Absolutely.